Hafa Guam, here are the headlines for CNMI.
CHCC is working together with the World Health Organization in learning about measles preparedness and safety.
It's a preparedness workshop, and so it goes through, the basics of doing risk assessment. So what's likely and what's not likely to happen during an outbreak. Where are our strengths, where are our gaps, and how can we address those gaps with, operating policies and preparedness effort.
Members of the public health, emergency preparedness, and clinical staff, along with some division heads, are currently attending a 3-day workshop about measles.
One of the things we're doing right now is like the simulation exercise that's going on in the other room. So, the simulation is someone's presented to the ER and they have a case of measles. So what happens? And so then we just jump into action and we say, what would we do? And so when we get to a block or a place where we say, oh, I don't know what we'd do, there we go. That's a place that we can have a new standard operating procedure or something. And the WHO is here to help us identify those and also come up with that plan.
According to CHCC's Public Information Officer Zoe Travis, no cases of measles have been found in the CNMI.
We haven't had any measles cases in the CNMI, no imported cases or local transmission, just no cases. The efforts we're doing right now are preparedness efforts because there's outbreaks in the region. Samoa is the biggest one, but also Tonga and Kiribati and New Zealand, I think a little bit. We need to be prepared.
Travis says children are more vulnerable to the virus, especially those under the age of 4 who cannot get vaccinated.
In the CNMI, over 90% of children are vaccinated. So we have really good coverage among children, but the percentage for adults is more like 50% of adults who are vaccinated. And so there's a big gap there with vaccinated people. And, even though it's more serious in children, it's really important that adults get vaccinated too.
CHCC encourages everyone to get vaccinated, which can prevent something called herd immunity.
And so herd immunity is if everyone's vaccinated, the people who can't get vaccinated are safe. So there's little babies can't get vaccinated, people who are sometimes undergoing chemotherapy or who have other advanced diseases, they aren't able to get vaccinated if their immune system is compromised. And so they're always going to be unprotected, or they're going to be unprotected until they can get vaccinated. And so in the meantime, they're relying on everyone around them to be healthy. So if everyone's vaccinated and no one can get the disease, it can't enter the community at all, and it can't get to those really vulnerable people.
The measles, mumps, and rubella vaccine is given in 2 doses. The first dose is 93% effective against measles, and the second dose is 97% effective.
Vaccinations are available through our immunization clinic, which is located down in public health by the dental clinic. You can also get adults can get them through the outpatient pharmacy, and you can do a walk-in to either the immunization clinic or the outpatient pharmacy.
CHCC does advise that if you think you or your child may be infected with measles, to contact your doctor immediately. And though symptoms of measles don't show until 7 to 14 days later, be aware of the signs and symptoms.
The early symptoms of measles often include a high fever, cough, runny nose, and red watery eyes. And also tiny white spots on the inside of the mouth, which are called Koplik spots. There's also the rash, which commonly appears 3 to 5 days after the other symptoms have started. And that usually begins on the flat red spots that appear on the hairline and then move down from there. And so that's the most commonly known symptom of measles, but the other symptoms start a little bit earlier.
This is Sally Lemus for KSPN News.
For more news, visit saipantv.com. For KSPN2 News, I'm Ashley McDowell.